Hi, everybody. I'm Dr. Ardis. This is the Dr. Ardis Show. And in studio today, I have an incredible guest you guys are familiar with. It's Michelle Rowton. And we're going to be discussing a very exciting topic. Supposedly, it's January 23rd of 2025 is going to be National Maternal Health Awareness Day, of just one day, where we're going to talk about and devote. Their theme this week is knowing what's at stake is the theme this year. What's at stake, I guess, for being pregnant? I don't know. And so I've invited Michelle to come in studio to talk about what are some key things I believe everyone around the world who's either been pregnant, going to be pregnant, has a relative or loved one who's going to be pregnant or is pregnant, what it is they should know and expect before they get pregnant or while they're pregnant that they're going to be told by their medical professionals or by their OBGYNs or by their midwife. Uh, and what questions they might have all their own for the first time being pregnant, possibly. There's a lot of things I think that we're going to discuss today that are going to be things you may have never considered. So I am a proud father of 5 kids who are all very healthy. We had our own rules, of course, while the mama of those children was pregnant. And then what were some things we made sure we did and didn't do during those pregnancies? There's a very popular book that everybody has and everybody owns, is receiving at their gender reveal parties or, whatever they're doing. That book is called What to Expect When You're Expecting. So everybody knows what to expect when it's coming. So during that period, though, I'm not sure everything in that book outlines what we, who are respecters of the natural order of pregnancy, we don't actually believe it's a medical condition, as the medical profession now has declared. Pregnancy is a medical condition. I'm not really sure how that's so when all of life has procreated without the medical profession saying it's our job to make sure this is a medical condition that we oversee. But when it comes to being pregnant, I'm sure you have a lot of questions. And I think you should have some guidance from somebody who helps people all naturally navigate the myriad of questions that come up for people when they are pregnant or when they're considering to become pregnant or wanting to extend their families. So let's dive into some of the misconceptions. And then what are some of the things that we absolutely, as natural health practitioners, always made sure our loved ones who were pregnant followed, and then what our patients and our clients and our practices who were pregnant or soon to become pregnant, looking to become pregnant, what were some of those things we wanted to make sure they knew going into pregnancy, trying to become pregnant, to make sure they went full term as best as possible, reducing the risk for miscarriages and abortions, obviously. And I mean, even self-terminating abortions, which would be a miscarriage. We want to make sure we try to create an environment internally that provides the opportunity for a well-functioning newborn to come into this life and have the greatest life possible. That's all we care for. All right, so Michelle Rowton's in the house. Michelle, say hi to the audiences.
Hello.
How many times have you been pregnant?
3.
3 times.
Yes.
Yeah. And what is it primarily you can share with the audiences, and I'll dive into? What are some things that people, when they become pregnant in this country or around the world, is it that the standard medical model wants to make sure you are told, make sure these things are done while you're pregnant to ensure a positive outcome?
So I'm remembering when I was pregnant with Julia that I was going with a midwife, but it was a midwives and a big OB group in McKinney, and they required you to come to a class to orient yourself to pregnancy. And it was the worst class I've ever attended in my entire life. Like I literally was in the back going, where am I right now and what is going on? So, I mean, the biggest things they said,
Wait, did you feel more oriented after the class was over now that you were
no,
pregnant?
no.
No. Okay.
I mean, I remember sitting in there and them going, okay, no soft cheeses like Velveeta. And I'm like, Velveeta's not cheese. It's a cheese like product. And this mom next to me is like, what? No Velveeta? I'm like, oh, like, you know what I mean? And if you're going to eat lunch meat, microwave it first. So that you kill any sort of bacteria like listeria on it. I'm like, okay, well, let's take a highly processed meat thing. And then if there is any nutrition, let's microwave it first. So let's just kill anything alive that could possibly be good for us in this food, and then you can eat it. And so they were worried about listeria. And I was sitting there going, well, so far I've worked at NICU for 14 years. And in 14 years, I've seen two babies that I can think of that were affected by mom contracting listeria.
Yeah.
So yeah, no hot dogs.
Man, that's a hot topic right now in the media over the last couple of months because of boar's head meat. They find listeria bacteria in some of their meats, doing all this recalls of millions. Okay, that's why it's coming up. Don't worry.
So you want to know what my favorite meal, my meal that I was obsessed about when I was pregnant with Julia?
Obviously not Kraft macaroni and cheese. Go ahead.
No, it was like organic grass-fed hot dogs with fermented sauerkraut and fermented pickles and onions. I mean, I was like obsessed.
Did you find that recipe in the What to Expect When You're Expecting book?
Absolutely not. They gave us a list of all the tests that we would have to have, you know, because we're now sickly people that need all the tests, all the vaccines that we would need while we were pregnant. And the glucose challenge test that we would have to do at whatever week. And so that was our orientation, was this is what's now wrong with you.
Yeah.
And this is how we're going to treat you like you're now a broken person. And we're going to give you really bad diet advice.
All right. Now, before anybody watching this presentation goes, I wonder if this is just all new info. Maybe Michelle's just had like 3 pregnancies in the last 3 years, and maybe she doesn't know the evolution of pregnancy recommendations in medicine. What was the first year you were pregnant? The year. First ever pregnant.
Okay, so I became pregnant 2015.
2015. All right. So 9 years ago. So in the last 9 years, do you think any recommendations from the medical profession to all pregnant women in America, has anything changed or evolved since that period? Just curious.
There are now more vaccines that they recommend for pregnant women.
Mm-hmm.
That has changed. Everything else seems the same. I'm sure a midwife has something else to add to that. I'm not a midwife, but as a general rule, they still give all of that advice, and now there are more vaccines.
Got it. All right. So how many pregnant women have you served in your practice who you found were vaccine deficient and therefore their children were suffering?
None.
Oh, that was a drop the mic right there. We're done. All right. None. Okay. Wow. That's quite the statistic. All right. So what vaccines do you recommend to all women when they come into your practice? You're like, make sure you do get these though, even though the CDC gives you a whole list. Any?
None.
Did you say one or none?
None.
All right. So look in the camera and tell them how many you recommend.
None.
Oh,
I remember coming around the corner. We brought our oldest, Nick, who's now 26, but he was like 16 when I was pregnant with Julia.
okay.
And John's like, you should come with us to the appointment today. And he says, okay. So we come around the corner and my midwife goes, Michelle, are you going to be getting your Tdap and flu shot today? Not one of the 3 of us looked at her. Not one of the 3 of us paused for even half of a second, but all 3 of us busted out laughing as we kept walking to like room number 3 or wherever they told us to go. And I could hear in the background going, okay, I guess that's a no. I mean, like even the 16-year-old was like, that's hilarious. And it's not happening.
Yes. Yeah. That is, I guess he had learned by that 16th year that there was no way y'all were budgeting on that one.
Right.
All right. Well, all right. So, Michelle, what we're going to do is we're going to put up on the screen what it is that the CDC does recommend are the vaccines currently all pregnant women in America should get. So let's put it on the screen here. We want to show them.
So the 2...
Hold on. We're going to go there. Hold on. I want to find out which. We'll just go here first. I just want to make sure I pull it up here. We'll do some editing after this in case I go to the wrong place. All right. So here is. Let's see where I put it. Oh, here we go. It's right there. All right, so here we go. This is the document, CDC's pregnancy and vaccine or vaccination recommendations before, during, and after pregnancy. We're going to go to during. All right, so we're going to scroll down here. Vaccines during pregnancy, whooping cough.
Yes, so the Tdap, they've been recommending or promoting, however you want to say it, for a very long time now.
All right, so what does Tdap stand for? And how is that different than DTaP for all those watching?
Okay, so Tdap is the adult one and DTaP is for the little kids. So tetanus, diphtheria, and pertussis.
Got it.
So you can either get TD, which is tetanus and diphtheria, or you can get Tdap, tetanus, diphtheria, pertussis, all 3 together. And they're wanting you to get the Tdap to cover you for whooping cough, which is pertussis.
The P in Tdap and DTaP is pertussis. There you go, the whooping cough. All right, so down here it says CDC recommends getting a whooping cough vaccine during the 27th week through the 36th week of each pregnancy, preferably during the earlier part of this time period. Do you have any adjusted recommendations there, or just if women who are pregnant in America are worried about getting the whooping cough and their OBGYNs tell them they need to get it, or their midwives tell them they need to get it, what would be your statements to them to help them know I do have an option or not?
You always have an option. It's your body.
Very good.
And just so you know, I mean, they go after the mom to have that, but then they implore the mothers to make sure dad gets it and grandparents and anyone who's visiting. So we kind of have this family clashing that to this day still happens, where someone will say, well, have you had your whooping cough vaccine? No, we don't vaccinate. Well, then you can't visit my baby. That happens a lot. So they're not even giving medical recommendation to the pregnant woman. They're giving medical recommendation to all of the other people that are around that person that they don't even know, which I find a little appalling.
All right. So whooping cough, Michelle, is there recommendations you have for moms sitting there going, well, what if my kid got whooping cough? Or what if I got it during pregnancy and I didn't get the vaccine? Are there natural ways, solutions for them to not be afraid of not getting the whooping cough vaccine or DTaP or Tdap?
I think one of the important things to realize is there are studies out there that if you are vaccinated for whooping cough, that you can become a silent carrier of pertussis or parapertussis. And so it would actually be good to know if grandma had whooping cough. If she doesn't, then we can't really be proactive. We're just waiting for the baby to get sick and have a cough and then eventually go, well, maybe we should swab for this, which we don't think of very often. We actually do have whooping cough in the Metroplex right now. And we had some in the summer, so it's probably just been circulating a little bit. So when you look at the data, 3 people about a year in the United States will die of whooping cough, and most of them will be under the age of 1.
Got it.
That's your stats.
Have you ever had a patient with whooping cough, a mom or a child, and you were able to give them recommendations to beat it and they survived? Or
Yes.
were all 3 of those people every year that get it your patients who died?
Never mind. Yeah. No, I've never had one that died. I have a 2-year-old patient right now that has it. I've had a young baby get it before, and so that was kind of a lot. But once we got through the first 2 weeks, everything was pretty solid. But we actually used Suzanne Humphrey's vitamin C protocol. And it's interesting. I knew we were meeting today, and then I was kind of talking to this mom, and so I went out and looked and like, what are the medical recommendations for whooping cough? Because after a certain point, if you give the antibiotics, it can just make them worse because of the die-off and the toxins and everything. And so when you start reading the studies, there are no, like, you're reading these studies and they basically no statistical significance that any of the treatments they did helped with anything. Not steroids, not antibiotics, not breathing treatments, like nothing really they had to work it out. But we find in the alternative world that if you use the vitamin, and if you go to the internet and search Suzanne Humphrey's vitamin C protocol, still right now, maybe use DuckDuckGo or for sure Brave browser, it will come up. And she did a very nice job, very lengthy discussion writing it up and how it works and how to do it.
It's awesome.
Yeah.
Love that. Look it up. Suzanne Humphreys, vitamin C protocol. Go do it. She's written some incredible books too. You should probably download those or purchase those for sure if you want to know more about vaccinating your kids. All right. So whooping cough, what's it sound like?
Well, it sounds like a whoop.
Whoop, whoop.
They don't
like
always do it. Like, they have a coughing fit. And then once they kind of get to the bottom of it, when they breathe back in.
Got it.
They don't always do that though. And so people sometimes miss it,
All right. Now, in the meantime, we're going to do some more sharing. We're going to stay on the whooping cough discussion, but we want to show the CDC's vaccine excipient summary, which is the summary of what are the additives in the Tdap vaccines. There's only 2 by name, brand name. You'll see them on the screen. It is Boostrix, and Adacel. Now, we're just going to highlight a couple of ingredients here, Michelle, and I would like to ask you, somebody who oversees the health of children throughout your practice and in your clinic, and then having been pregnant 3 times yourself. They're recommending this for pregnant women. The first 2 ingredients in Adacel, listed by the CDC's own document, is aluminum phosphate and formaldehyde. Can you tell me why a baby would benefit from injecting the mother while pregnant with any aluminum or any formaldehyde? What's the health benefits to the fetus that we know of, if any?
I have yet to figure that out.
Do we know of any detrimental effects of aluminum and formaldehyde exposure in a developing fetus?
There are plenty of studies that heavy metal and aluminum exposure during pregnancy does make it to the fetus. I mean, they found it in cord blood and brain tissue and all sorts of different places.
I just want all of y'all to know that the very first ingredient in one of only 2 Tdap vaccines that are listed on the CDC's schedule for the pregnant women they recommend it for, aluminum phosphate, is a known neurotoxin. It actually damages neurological tissue. It is implicated in adulthood and in children in ADD, ADHD, autism, Alzheimer's, MS, Parkinson's in adults. So I'm not really sure that injecting aluminum into any human being is a good idea. Formaldehyde, we know, is a preservative they use for embalming tissues, meaning preserving dead cells. I mean, they use that in embalming procedures. Then I want to highlight that also in the second vaccine listed there, Boostrix, you will see aluminum is also an ingredient there, along with sodium chloride, which is actually saline water. But then you'll see polysorbate 80, and I want you to know about this one. Polysorbate 80 actually is published. I actually did an entire presentation on flu vaccines, polysorbate 80s, and 6 of them, of the 9. Polysorbate 80 is published to damage the developing fetus or a child or adult's spinal column and leads to scoliosis of all mammals, including humans. And so polysorbate 80 in cosmetics, in artificially processed foods, and in vaccines directly causes loss of integrity of cartilage, disc, and ligaments that hold the spinal column together. Just as one scenario, there's a lot of scoliosis in America in children and adults. You can directly pinpoint it to polysorbate 80's published ability to cause weakening of the spinal column. You'll also see formaldehyde's another ingredient in there. Anything else that jumps out at you there?
I mean, what jumps out at me is, I mean, you were looking at polysorbate 80 because you were talking about flu vaccines. So they also recommend the flu vaccine while mom is pregnant.
We're going to stop sharing there.
So you get a double whammy there. And then what they do for the infants, their first year of life, when they get the flu shot, they get 2.
All right, so there's the whooping cough. Now, this is the CDC's document again for pregnancy and vaccination, what they recommend during pregnancies. We've already covered whooping cough. We're now going to move to the flu shot. All right, so they do recommend the flu shot, and they say here, CDC recommends getting flu vaccines by the end of October. And they say make sure to receive your yearly flu vaccine. It's the best way for a pregnant woman to protect against the flu and protect the baby for several months after birth from flu-related complications. All right, so let's just stop share there. Michelle, do you agree with that statement from the CDC that the flu vaccines will protect the mother while pregnant and the baby for the first 3 months or so of birth from getting the flu?
I mean, do they read the studies on the flu shot and how well it works? That's what always blows my mind. I mean,
I can tell you it's 4% effectiveness rate lifetime for the entire history of the flu vaccine program. 4% efficacy. Now, just in case you didn't put the math together, that means 96 out of every 100 flu vaccines fails at providing any immunity to the person they get. 96 out of 100 flu shots suck at preventing the person receiving them from having flu prevention of any kind.
right. And for that toxic load that you just went through in the ingredients, I mean, I've been pregnant or breastfeeding for, I mean, I had a little break in there between Jason and Victoria, but for 10 years. Like, this is why I have gray hair, because I won't even color my hair because I'm pregnant or I'm breastfeeding. So why would I inject that into myself for a 4% efficacy?
Amen to that. And actually, did you know, Michelle, and did you guys know at home, that there is 4% of all people who receive flu vaccines report a neurological disease or symptom injury to flu vaccines. 4% of all flu vaccines have a Guillain-Barré syndrome diagnosis accompanying the injury from the flu vaccine. 4%. That means the exact amount of people who have benefit, 4% of all those that get the flu vaccines, that's only 4% of people that get them have any benefit whatsoever to prevent the flu outbreak or a symptom. The same amount, 4% of all people that get flu vaccines will develop Guillain-Barré syndrome, meaning they will be paralyzed from the leg up on one side. Ask your doctor if Guillain-Barré syndrome, modern day polio, is right for you and your baby when you give them the flu shot. Any thoughts?
I've never had a baby patient die of the flu. I have had families come in that they have their second baby and the first one died after taking Tamiflu. I've had that several times over the last 10 years or so, where they've come in and they're acting nervous to come into the office or to talk about this subject, right? Because I'm sure they've had people not be very nice to them. And of course, my response is, I'm so sorry that happened to you. That's not okay. You don't have to give your baby anything that you don't want to give your baby because it's your baby and that's your choice, you know? So.
All right, so let's dive in here to the flu vaccine now and the vaccine excipient summary. Since this is the second vaccine they list on the CDC's document that they recommend during pregnancy. So let's highlight these, shall we? So we're going to go up to the flu influenza virus vaccines. You'll see them here. There's your list. And I think it continues down here. Yep, there's two more down here, three more down here. So you will see their names. These are all the brand names: Afluria, Fluad, Fluarix, Flublock, Flucelvax, Flulavil, Fluvarin, Fluzone, more Fluzones, and then you have the one you snort called Flu Mist. All right, so a couple things to highlight here. Just want to make sure we highlight. Do you see this up here? It says CDC vaccine excipient summary. I'm not lying. I got this from the CDC. This is their vaccine excipient summary, and you can pull it up on the internet. All right, so they give you the summary, but let's go back to the flu vaccines. All right, so you were pointing at the screen. What were you pointing at?
Oh, my favorite one is the Cocker Spaniel kidney cell.
This right here. This is awesome.
I mean, yes, I've looked at these lists enough that I pick out my favorites. That's my favorite one out of the flu list. It's just.
So she said Cocker Spaniel. I just want to make sure you guys know. Medine Darby canine kidney cells. That canine word means dog. So that's a dog's kidney, but Medine Darby is the scientific name for Cocker Spaniel dogs. So if you are in your medical doctor's office or your OBGYN's office and they're telling you you need to get a flu vaccine for pregnancy, and you should look at your medical doctor and say, thank you, OBGYN. Which one of the 9 different brand names flu vaccines do you carry here that you recommend? I just showed you the 9 different name brands of all these flu vaccines. Okay. Which one do you recommend? If they come back and say, we carry in our office Flucelvax for all of our pregnant women, you should ask them. The first ingredient is Cocker Spaniel kidney cells. OBGYN, can you please explain to me how a dog's kidney cells are going to help me prevent a lung infection called the flu? And your doctor should be pissed that they had no idea that was the first ingredient in there. So I would like to ask Michelle Rowton, how many babies born in America are deficient in canine kidney cells?
I think 0 of them.
0 are deficient. All right. So what kind of complications could you imagine would come from injecting some other species dog's kidney cells into a pregnant woman or into a baby at 6 months old, like the CDC recommends, the flu shots?
Wouldn't it be great if we actually studied that kind of stuff?
Yeah, I will just tell you now. I can already tell you what's going to happen. Autoimmune diseases are going to develop. Just remember, everybody watching at home, anybody who gets an organ transplant, when you get an organ transplant, they put you on autoimmune rejection drugs, immune suppression drugs, because the DNA makeup of that organ is not yours. It's from another person. So when that DNA gets inserted inside of you, and then picture pig valves in humans, that's a different species. They also have to put you on autoimmune rejection drugs, turning off your immune system, because your body will start attacking that tissue and anything surrounding it, which is you. And you will develop any form of autoimmune diseases. Ask your doctor if autoimmune disease is right for you, pregnant woman, and the fetus in the womb. All right, so we're not even going to stop there. You've got polysorbate 80, I've already mentioned in 6 of these. Did you know that there is neomycin and kanamycin in 6 of the 9? And did you know that of those, it's either 7 or 6 of these, have neomycin or kanamycin in them. This is an antibiotic, and antibiotics do not treat viruses, which is the flu virus vaccine is supposedly for a virus. Neomycin and kanamycin are two antibiotics that are published in children and in adults to cause within 24 hours or 48 hours of it entering their body, getting to the otitis media, the inner ear, damaging the inner ear structures and causing permanent tinnitus that leads to permanent deafness. That is a published side effect in humans of these two antibiotics that are in 6 or 7 of the 9 different flu vaccines. Then you'll see a formaldehyde in many of these, which we already know is a known carcinogen. It causes cancer. You see ovalbumin. This is egg whites from either chickens or snake eggs. And I'm not joking. Chicken eggs or snake eggs. That's where they develop these from. So ovalbumin, lots of kids have egg allergies. I'm just telling you right now, ask your doctor if they tell you to get a flu vaccine, which one is it? And if it contains either egg protein, which they name it by, or ovalbumin, which is egg white proteins from chickens or snake eggs, ask them, are you telling me that an egg allergy for my child is right for them? How many children have egg allergies?
A lot.
A lot. Do you want to know why? You're injecting foreign proteins into the bloodstream. And I would like to ask right now, I'm going to turn this off. Michelle Rowton, I'd like to ask you a question. Does it make sense to you to inject egg whites into the bloodstream directly? Or were human beings designed to eat eggs and break it down in their intestines first before any nutrients got into the bloodstream?
Definitely eat.
Eating.
We should eat eggs.
Okay,
and
good.
Also peanuts. We should eat those. We should not inject them.
Good.
Yeah.
Now, outside of this discussion with the flu vaccines, any other things you educate parents about or that you've learned in your education and clinical practice about how to reduce allergies, asthma, food allergies, environment allergies in children while the mother's pregnant with the baby? Is there anything you've learned that helps reduce the risk for those things, allergies, asthma in children, which is so common?
One of the big things is to stay away from Tylenol for mom and the babies.
Uh-huh.
That's in the literature. The rest of it is a mess when you look at it. Okay. So the newest thing is that mom should eat all of the things while they're pregnant so that the baby won't have an allergy to them later in life. And I was joking with one of my midwife friends recently. It's like when you have a baby that's being breastfed and they're screaming bloody murder and you know something mom is eating is setting them off. And a lot of times it's dairy. But if you ask them, like, tell me what you ate the most during pregnancy or what you were craving. Or if I took a food away from you right now that you would have an emotional response to not getting to have anymore, what would that be? And every time that's what the baby's reacting to. So I'm like, I don't know who comes up with this, but I see it over and over and over again. And I'm very good at taking babies who are screaming 23 hours a day and getting them to stop. Some easier than others, but a lot of times they're like, man, you just nailed it straight out of the box. That's literally what I'm asking them. And then taking them off the food. And the baby's like, thank you. I feel so much better. So Jason James was a screamer. You know what he really hated more than anything? Eggs and bell peppers were the devil. And you know what I ate every day? I was obsessed with in my pregnancy with him. Sieta tortilla, so gluten-free tortilla because I'm allergic to wheat. Eggs, we have 30 chickens, and salsa. That's what I ate every day. And day of life 5, he was like, not anymore. And for an entire year of his life, I could not eat either of those foods.
All right. Now, what were some of the symptoms of this kid within the first 5 days where you realize something's wrong with my kid? Maybe I should change what I'm eating that might impact the kid. And he's only 5 days old, right? So
he was spitting up everywhere.
Pay attention, families and mamas.
Like gurgling and refluxing. He was screaming. Did I mention he was screaming?
You mentioned he was screaming.
And lots of vomiting. Man, I remember going to a party and someone going, I made you egg-free potato salad. I'm like, thank you so much. I'm eating the potato salad. I'm like, man, this tastes way too good. What'd you put in this? And then they told me they put mayonnaise in it, like real mayonnaise. And they meant, like, in their head, they're like, well, I add like hard-boiled egg to my potato salad. So I didn't I fed him and then we were out by the pool and he is like barfing all over the pool deck. Like they're having to hose it down. They're like, sorry. I'm like, yeah, like he's not kidding. So he was about, I could have eggs after he was a year. And then after a while, I would put them on his tray with other food because obviously I didn't feed it to him for a long time. He literally would look at the food on his tray, go to the eggs, and go like this and shove them off and then eat the rest of his food. So he was probably 18 months before he would eat them. I mean, he wasn't kidding, but he did not appreciate that. And I know that's anecdotal and I'm giving my own story, but I see it with these kids all the time.
Yeah, we can talk about anecdotal experiences yourself, but then when you apply that information to the thousands of moms you've treated and kids,
Babies.
oh my
That's it.
goodness, all day long, that's all she does.
And so then they'll be like, people told me to come to you or like have a phone consult with you from whatever state because like my baby will not stop screaming. And I just ask a ton of questions because I see all of these patterns. I'm like, okay, let's pull this and this. And they're like, oh my gosh, he's so much better. I'm like, you're welcome. So they give a lot of really bizarre advice during pregnancy about diet. And none of it is, and they'll give calorie count, but none of it is you need to have lots of protein so that you have a less of a chance of getting preeclampsia. And if you are showing that, you need to go up to like 100 grams of protein a day. A midwife will tell you that, not an OB. They'll just let you, so they can see, they'll C-section you once you're bad, right? They don't say, hey, cholesterol is the precursor for all hormones and you need it to build every cell in the body. And so you need to have as much healthy fat as possible. The brain is 60% fat. You have to have a lot of healthy fat. Nobody is talking about that. And that you're building this human, and I lovingly call them parasitic leeches, and I'm allowed to because I've been specializing them for 22 years, and I would have way more babies if I wasn't 44. They win. Like your body will suck everything out of you. Why do you have lots of cavities? Because they sucked every mineral you had out of your body to build their bones. And why, if I have a mom that says, man, breastfeeding makes me so stupid, I'm like, that's actually not a thing. You're not eating enough healthy fat. You're growing a brain that's 60% fat and breast milk is 56% cholesterol. And so nobody's talking about this. They're giving these like silly don't eat Velveeta cheese and microwave your gross, what like Oscar Mayer or something or other. And you should eat lots of peanut butter so they're not allergic to peanut butter, which is high in mold and mycobacterium and inflammatory. Like there's no good information going on. None.
Peanut butter only contains aflatoxin, a known cancer-causing fungus. So, yeah, make sure every pregnant woman's eating high amounts of peanut butter and peanuts. That's so weird. All right, so you've already mentioned that the absurdity to some extent of what the medical profession conventionally will recommend during pregnancy dietary-wise. Anything dietary-wise before we dive into the other two vaccines that they recommend for all pregnant women. But any dietary recommendations that you have, or is it more general rules for pregnant women? Like I see a lot of people obsessed about sleep schedules on time. Everything now has to be documented and scheduled. Is that the same thing for diets for women, like weights, weight gain, BMI during pregnancy, calorie counts? Is it really that specific or is it more general?
It's a pretty blanket response. I mean, they do have weight gain that they're tracking. My mother-in-law is 84 and she goes, when I was pregnant, they only wanted us to gain 15 pounds, which is completely insane because by the time you triple your blood volume and grow a placenta and the human, that's more than 15 pounds, right? So you had that going on all those years ago. And so now
that just sounds crazy to me.
They're much obviously way more lenient, but they are concerned if you start out obese before the pregnancy or you have other health issues going on that you have a higher chance of being high risk and having issues and things like that. But nobody's really giving any sort of real solid usable information.
All right. So it's more information than just Velveeta. So there's other sources of fat people can consume other than Velveeta, you're saying? Yeah.
Right.
And fat is essential.
Weston A. Price Foundation.
I do very well.
I mean, if you go there and look at their recommended diet for pregnant women, that would be a good place to start. Do I think that someone who's eating the standard American diet is going to suddenly be like, liver sounds awesome, I'm going to eat that 3 times a week? I mean, they're probably not going to do that, but they could at least look at it and go, wow, that's a lot of protein. That's a lot of healthy fat. Okay, here's the vegetables. Here's the fruit. Does that make sense? Like
Yes.
it would be eye-opening to go over and look at something like that that has a lot of really good research behind it.
In fact, I'll go ahead and recommend the book. It's titled Nourishing Traditions. You should buy the book. That's a Weston A. Price Foundation, basic, like canonized scripture for Weston A. Price and eating healthy. You might want to, and gardening and fermenting foods and learning how to actually feed yourself nutritionally rich food you need, including fats, just so you know. Nourishing Traditions is the book. Had it for years. I've actually lectured at Weston A. Price charters or chapters all over Tennessee starting in 2004. Loved it.
And then, of course, they tell you to take your folic acid, which is a whole other, that we could do a whole.
Oh, Michelle. No, Michelle, look in the camera and tell them just how important folic acid is to take during pregnancy.
Please don't take that.
Mm.
Don't take that. Take good B vitamins, eat real food, juice. Methylfolate would be better. Or, I mean, we could get into the whole MTHFR. What about this folate or that folate? You could do all of that. But I mean, they are sending these people to Walmart, to the junk supplement aisle for folic acid.
All right. So, what other sources? You mentioned a few, but give some real direct ways, because I promise you, everybody watching is really programmed, really indoctrinated that vitamin B9, folic acid, folate is super important for me to take or recommend my daughter takes while she's pregnant. What are some other sources of foods they should be consuming to get their B vitamins they need to help ensure there's less chance of genetic defects or congenital defects when the baby's born?
What if we like ate leafy green vegetables? That
Wait.
would be helpful.
That has B vitamins in it.
And getting B12 from proteins. I mean, I have taken care of kids with midline defects, right? They have a cleft palate or something else going on in the midline of the body, and that is tied to having a deficit in B vitamins, and it happens. I've had moms that come in and they find me, and we have a good appointment, talk about how we're going to handle the midline defect in the child. And then at some point we sit down and we have a conversation and say, hey, if you're going to have another child, we need like at least 6 month, if not a 12-month lead time, that we're making sure we're getting these nutrients in. And yes, you can take high quality vitamins, food-based or the bioavailable B vitamins, methylated, whatever you want to call them or argue about in that whole genre of stuff, while we're making sure we're getting that into our diet before we have another baby.
So right? I can already feel the audience asking, oh, wait, what about these kids that are already born that have these genetic midline defects? Have you seen improvements in them by supplementing B vitamins after they're born?
Yes.
Yay, great. Can you talk to that a little bit, or what are people going to be expecting? Not that you can reverse everything completely, but what kind of improvements have you seen?
But you know what I think about is, say you have a baby with a cleft palate or they have a spine defect or whatever. And so it's not always the case, but there is a high correlation that you had low B vitamins, right? And so now we need to fix those kids. So they go into surgery, and what does general anesthesia drain?
B vitamins.
B vitamins and glutathione. And so we're really just putting them on this wheel that they can't get out from under, right? And so then if they're getting Tylenol all the time and antibiotics and they're getting vaccines, and I mean, it's like we're just kicking them over and over again.
And I'll just explain this to you. What you're learning here is just because the kid's been born, their development hasn't ended after they've been born. You can actually continue to feed them nutrients. This little baby's going to grow and have every cell in its body replaced over and over and over every single year for years and years and years of their life. Yes, start feeding it right away. It can make a difference even after they're born. I mean, the brain itself isn't fully developed until 3 years of age. So that amount of fats consumed in the breast milk, which is what we talked about earlier already, the fats that help the nervous system develop, it is very essential that there's lots of fats, healthy fats being delivered to the baby in order to even develop a healthy nervous system. It's not done. Just because you're born doesn't mean you're fixed and done developing. You still have things to develop. And man, more than ever, there's C-sections scheduled preterm before they go to full pregnancy. We don't even let people go to full term anymore. So how do you know if they're done developing or not? I always think this is ridiculous. How many chicken farmers, Michelle, crack the egg early because they're on a schedule crunch? They just crack the egg early and get the egg out, chicken out now. I need it out now. Why do we do this with human beings? I don't understand. It drives me nuts. Any thoughts about that?
I don't know. Chickens hatch in 21 to 25 days. 1 August, I had eggs hatching in 18 days because it was so hot. But we don't just go out there and go, well, 21 days. That's when I marked these eggs and set them under broody mom. So I'm just going to start cracking them. I'm like, okay, well, we could have up to 25.
You don't tell your husband to go out there with a hammer, start cracking them open because you're going on vacation the next day, and this is going to interrupt your schedule if you wait for the full cycle of nature to take its course. No, you don't do that like we do to all women in America. Just off the top of my cuff, I would just like to ask you: are you shocked at the number of pregnancies in America that are ended with C-section?
Yes.
The sheer volume.
It's a lot. I mean, we're sitting at like 35% at a lot of the hospitals. I just always tell people emergency medicine is there for a reason and we need them and they do save lives. But man, I mean, I can't tell you how often I'd go in and look at the board because you could pull up the L&D board in NICU and you look at the board and it would be Thursday and Friday and it'd just be like induction. And I'd be like, I should probably eat my dinner at 5 because maybe 4:30 because 6:30, 7:30, 8. We need you in the OR for a C-section, failure to progress. We need you in the OR C-section, fetal distress, and they put the mom through all the paces. And then sometimes you would have a kid that would crash and we go down there and resuscitate the kid and all the staff would be like, well, thank God she delivered in the hospital because could you imagine if you delivered at home? And I'm like, I mean,
can you imagine if we let this go to full term?
Super stressed out at home because you didn't start with Cytotec and then pump up the Pitocin and then give mom an epidural and tell her not to move. And I mean, again, were there true emergencies and thank God we're there? Yes, but man, they are clueless about the chaos that they cause. I remember years ago sitting at, we would do like a literature review once a quarter, it was like an excuse for the medical staff for us to go have like a fancy dinner somewhere. And then you'd be like, okay, well, you look at this from this to this date to this date, and you pull something from here and everybody would pull it. And this nurse practitioner presented this new study. I mean, this was several years ago, but going back over that, continuous fetal monitoring during labor and delivery has never shown better outcomes for the infant and has only showed increased intervention.
Wow.
And I'm sitting there and I'm like, I mean, doesn't everybody know that? And there was a doctor who was originally from Scotland and he was like, yes, that is, yes, thank you. I guess we need to talk about that.
Yep.
Like, why are you surprised? But they really don't know.
All right. So less intervention sometimes is better.
Yeah.
Amen. All right. So we're going to continue here. Let's go to the third vaccine they still recommend now to all pregnant women. Let's dive into that CDC document. The third is RSV. What does RSV stand for?
Respiratory I can never say it.
Syncytial
virus.
All right.
So this is a virus that for adults, you're just like, wow, that's a lot of snot. This is annoying. And then for the little babies, it's harder on them. So I call it exorcist snot. I mean, it's like almost like somebody just turned a faucet on and it just runs. And the secretions are really like soapy looking. They're viscous. Yeah. So they're just harder. It's harder in the lungs to clear and it props things open that you don't want to be propped open, so they can have a harder time. And so if I have an infant that is, 6 weeks old and they appear to have RSV, I will definitely go on the offensive with them sooner rather than later, because there's a decent amount that are admitted with RSV to children's hospitals. I always find it interesting because the news kicks that up and I'm like, it's not different than every other year. And sometimes in DFW, they'll be like, the hospitals are completely full of children with RSV. There's no beds left. And I'll get a message on Facebook from a nurse that works at Dallas Children's. And she's like, what are they talking about? We have beds. And I'm like, they do, like they're finally hearing it. And I'm like, oh, they do that every year. It's like just in their queue. And I go, and sometimes it probably is true. But as you're seeing now, you just worked last night and you realize there are plenty of beds. And this is what the news story is. So they only gave RSV vaccines to preemies for a long time. And this had to have been Julia's 9, maybe 12, 13 years ago, a big study came out of a giant database, and they really looked at the kids that had the RSV vaccine, and they would only give them to like the very low infant birth weights, like 28, but then they're like, oh, well, maybe the 30-weekers can have it. Maybe the 32-weekers. They just kept bumping it up, and it's like $1,000 a shot, and it's this big deal. So the reps show up from the company and they say, hey, good news. We have these forms that you can fill out and give to us. We'll come pick it up every week of the kids that you're discharging that got their first RSV shot. And then you can give it to us. And that way we can track them to make sure that they get the rest of them. Because we don't want kids to fall through the cracks because we care like so much. Okay. And so one of my doctor friends from India she's like looking at me. We're looking at each other going, okay, first of all, I don't think this is legal. And the hospital's like, fantastic. Here's our new process. We're like, you can't just hand out patient information to a pharmaceutical company.
Hello, HIPAA.
Right. And like, what are we doing? And so anyways, all this data came out, and what they saw was, especially for the older infants, like older than 28 weeks gestation when they were born, that they actually had a higher hospital admission rate than the kids who didn't get the RSV vaccine. And so then the recommendations came around and said, oh, we're going to knock this way back. And the pharmaceutical companies got pissed. And so the AAP shot back around and was like, never mind, and bumped it back up again. Oh. I mean, so there's been like tomfoolery and pandemonium going on about the RSV vaccine for well over a decade now, easy. And so now they are adding it to mom during pregnancy. They're now added it to the newborn schedule. So hepatitis B and RSV vaccine before discharge. And now they're giving it to the old farts.
So like in the first day of life in America, they're getting hepatitis B and RSV before they're discharged, the babies.
Yes.
When all my kids were born in hospitals, it was just the hepatitis B vaccine.
Not only did they add it to pregnancy, like it's been added now for every age.
Well, all right. So you mentioned earlier that if you had a newborn that comes in and they do have RSV symptoms, you said you go on the offensive. I'd like to ask, is that offensive finally giving them the RSV vaccine? Is that the offensive?
I mean, I can handle most things without medications, but I'll give them albuterol to pop them open.
Awesome. Do you also dive into maybe the vitamin C recommendations of Suzanne Humphrey? Like, is that also included for RSV or just whooping cough?
I load mom with RSV. Like I will have her load
with vitamin C
till pay dirt, just taking it every hour until like my tummy is making a lot of noise or I pooped a lot today. You will get some dump into the breast milk at that point, and that helps. But if they're that small, I'm really not trying to put anything into their gut. And Suzanne Humphreys talks about that with, if you have a very young infant with whooping cough, that mom has to basically keep herself fully loaded at all times.
Awesome. I love that recommendation.
So, yeah.
Wait. Okay. So what about while pregnant? Is it safe to consume vitamin C throughout pregnancy versus feeling like you have to be pressured to get an RSV vaccine they now recommend for all pregnant women?
You can take RSV or you can take vitamin C while you're pregnant. I didn't know this, but I was, when I was pregnant with this last one, I think it was my doula said that there was some study, and of course I didn't read it and I don't know how great it is, that taking a lot of liposomal vitamin C during pregnancy was something about the placenta. I don't remember.
Something positive, maybe?
Something negative.
Something negative?
So I was like, well, that's all I have in my house. And if I need vitamin C, I take it, but I'm not loading myself with it all the time.
Yeah. But there are natural antidotes and some medicinal things you can recommend that are safe for children.
Yes.
If they have RSV, they don't necessarily need a vaccine for that. No. And do all babies, the high percentage of all babies get RSV?
Everybody is going to get RSV. 100% of people.
Okay.
Even if you're vaccinated for RSV, you will get RSV at some point in your life and multiple times.
Got it. So what are we afraid of?
Lack of money made. I'm not quite sure.
Right.
Have I had kids? I had a toddler admitted to the hospital for RSV this year, and he is an ex-preemie. He's adopted. born addicted to all the drugs and positive for syphilis and also, I mean, he's doing so good because the way adoptive parents have raised him, and he's like actually on track for everything for
Awesome.
his age, but he did have to go in. So I just tell people, I'm like, usually if I have kids admitted, it will be an ex-NICU kid. Um, they do fine. So yeah.
Good. All right. So don't worry about the RSV, right? You don't have a lot of concerns about that. Want to recommend pregnant women to get the RSV vaccine? Do you recommend that to them? No.
No. And you know, people, you have people that are, yeah, everybody has their own germ tolerance and risk averse, whatever in history in their family. I'm like, you know, don't go to church and pass the baby around like a football. Sure. Don't live like a recluse. Like, just use common sense.
I love
Is
that.
what I tell people.
I love it. All right. So let's go dive back into here.
And so
The
then the
next one is the COVID-19 vaccines. Yay, this is brand new, not something my kids would have been recommended to when their mother was pregnant with them. So, how do you feel about the COVID-19 vaccines for pregnant women?
So when they started doing the COVID vaccines in pregnant women, I had contact from all over the country and other countries, OBs, neonatologists. And of course, that's when, you know how it is with people, when everything's new and everybody's talking about it, they're all talking about it now. I don't have people contacting me all the time, but when they started, just when they rolled out the vaccine and everybody was lining up to get them, I had neonatologists, neonatal nurse practitioners, OBs from all over the place telling me that they would have these moms that would come in to L&D for lack of fetal movement, and they would do a sono, and suddenly there was no fluid for the baby. Like the fluid was gone.
Wow.
And so a lot of these doctors started, you know, when they were doing their history and their timeline, would look at or ask about or look into the medical chart if it was all the same system of when their last appointment was. And so a lot of them would end up having had a, I call them like well checks, but you know, a prenatal appointment where you're going in as a healthy person, usually to just make sure everything's fine. They would have been in within the previous couple of weeks and had their COVID vaccine. And so they would do stat C-sections on these kids once they would say, oh, you're really not moving and you have no fluid. And then I got reports about their pupils being dilated, or they would say their pupils were blown, but their pupils were dilated and non-reactive. And it was enough that I probably had 30 to 35 contacts about it.
Wow, that's a lot.
Yeah.
All right, so I'll just say I do not recommend the COVID-19 vaccines. And if you're wondering why, buy my book, Moving Beyond COVID-19 Lies. You can read several chapters over what we know about the COVID-19 vaccines, the injuries they know from the COVID-19 vaccines. And just so y'all know, October 22nd, 2020, I show you in the book, the FDA's executives all had a Zoom call because everything was locked down, October 22nd, 2020. And they actually opened it up for the public to watch. And I watched it and downloaded this PowerPoint by Dr. Anderson, who presented it. On slide 16, it was listed that miscarriages were going to be a side effect reported when the COVID-19 vaccines were to come out 2 months later. So the government already knew miscarriages were going to be a side effect of the COVID-19 vaccines. I would never recommend any COVID-19 vaccine for a pregnant woman. Just on that basis alone, our FDA, federal health agency, already knew and published before these vaccines started being given to women, it was going to cause miscarriages. Do not trust the COVID-19 vaccines during pregnancy, is all I'd recommend. If you're pregnant and want a full-term pregnancy, just so you know, if that's your outcome. If your goal is to see, can you actually end this pregnancy and use it as a contraceptive, the COVID-19 vaccines have been proven to be effective. Just so you know.
I will tell you the other thing that I saw, and this is postpartum, is I did have quite a few babies come in that were they had their primary care providers and the baby wasn't doing well. And I had these babies that like literally had no idea how to eat. You know, I just joke, oh, I worked in NICU for 14 years. Like I can feed a bottle to a shoe. Like, you know what I mean? Like I've done this a lot. And so I go, okay, well, we're going to have an hour appointment. I have a lot of questions. I need to observe, bring a bottle, whatever you're doing. I mean, you're literally like trying, you know, holding the bottle in the baby's mouth and they're like, I mean, no idea. Okay. So there was a lot of just weird stuff. And I think everything was so many people were getting the vaccine and it was so dense that I was able to see the same things over and over again. Not anymore. I think that the uptake, well, we see that the uptake is now very low, way low of the COVID vaccine, and the people that are still getting them during pregnancy probably aren't finding their way to like a teeny cash practice, you know? But the other thing that we were seeing was you would have these moms who their breast milk came in, they're breastfeeding, or even some of them that had lactation specialists, and they'd had their ties released. You know, they worked really hard to have this breastfeeding relationship and have their milk and their supply and everything. And they would get their COVID vaccine. And it was like, I mean, we saw them, my husband was seeing them for body work. They were like 911, I need help. Like their boobs were just getting bigger with the milk, but it wouldn't come out.
Jeez.
I mean, and so by the time, and we don't know, at first we were like, is it an inflammation thing? And so it just literally can't come through the ducts, or is this like a cut in the hormonal cascade? Because it is a hormonal cascade that causes a letdown.
Sure.
Right. But by the time all of that went away, you know, when you're not removing milk from the body goes, oh, I guess the baby doesn't need milk anymore, and your supply plummets. And so by the time whatever that was got worked out, maybe mom was making 30 ounces a day before. She either had none left or she was making like 8 to 10 ounces a day. Jeez. And like it never came back. And so, I mean, between myself and my husband's office that does body work on pregnant women and postpartum women and infants all the time, and all of my lactation friends and my midwife friends, I mean, we had lots of conversations about this because it was pretty mind-boggling at the time.
Yeah, it's incredible. All right, so we're going to quiz Dr. Ardis's brain here. Is the hormone that oversees the letdown of the milk in breastfeeding scenarios, is it called prolactin? Is that the hormone, or is there a different hormone?
No, prolactin is the one that brings it in.
Okay.
And it's
this is me learning.
Yeah, you're totally going to hurt my brain, and my baby woke me up a lot last night.
I was just curious. I was like, is that the prolactin hormone?
I mean,
I'm assuming
we had some OB providers, like they have it in like a snort. Like you can order it.
You can snort your hormone?
It up to like try to get the milk to let down.
Oh.
And it didn't work.
All right. Okay. Next thing, let's dive into gestational diabetes. This is a very, very big deal for a lot of women during pregnancy. Lots of women are concerned about it. The doctors are concerned. The OBGYNs are asking them to track their blood glucose levels. There's even this thing called Glucola. I've recently learned about the name of this brand glucose test. You drink 50 grams.
50 grams of sugar.
That's 50,000 milligrams of sugar. You drink it, and within 1 hour, you take a blood test during pregnancy to determine whether or not someone's got gestational diabetes. All right. I would like to hear Michelle Rowton educate you all, like she did with me off air. What is a different test you believe people should be looking at that doesn't require them drinking 50,000 milligrams or 5,000 grams, 50 grams of glucose to do a blood sugar test at some point in the pregnancy? So talk about the test. I love this, actually. I think this is a better recommendation. It can be done, and you don't have to take the blood sugar or take the sugar cola like they recommend. All right, talk about gestational diabetes in pregnant women.
So shocked that I've been pregnant 3 times, and I have never drank that. First of all, 50 grams of sugar is a lot. I never sit down and eat 50 grams of sugar. I don't even really like sugar.
I'm going to go ahead and correct it. That's 50,000 milligrams, by the way. Okay, go ahead.
50,000 milligrams, and it has food dye. It's like bright yellow and preservatives and all the other things.
Are any babies, do they require, as developing in the womb of their mother, do they require artificial food color dyes for that development? No? Okay.
No,
all right. Well,
not good for the brain.
All right. Very good. All right. So talk about the test with gestational diabetes.
So there are the people that do the test. So, you know, you're sugar loading and then you're checking blood sugar levels. Okay. You can use orange juice. You can use jelly beans. I still would never eat jelly beans, but like the crunchy folk, there are like dye-free organic jelly beans. Whatever you can do to hit your 50-ish grams of sugar.
Can you use like a Starbucks Frappuccino, load it with ice cream? Can you do that? That's what everybody's wondering right now.
Yeah. Everybody's like from the caffeine and the sugar buzz.
Now these tests, loading up on sugar, is called the glucose tolerance test. You'll see it abbreviated GTT. That's
Yeah.
what it is. All right. So just say no. They do
So
this during pregnancy a lot.
yeah, some people will do those alternative sugar loads. And then some people are like, I'm not going to do the sugar load at all. And so those moms are asked to get a glucometer to poke their finger like you would if you had diabetes and check first thing in the morning and after meals for a couple of weeks and report that to their provider. I know you're shocked I also didn't do that. I think with Julia, one time I actually went out to eat during lunch at the office one day and I was like, wow, that was a lot of carbs. I don't usually do that. And so I waited an hour and 2 hours after and like went into the back and poked my finger and I was like, oh, my sugar is 80. I'm probably fine. Right. So I didn't check it a lot. But interestingly enough, I learned when I was pregnant with my last one that there's good literature showing that what the hemoglobin A1C level is, which is just simply put your average daily blood sugar for the previous 90 days. How that sits in your first trimester is directly correlated to your incidence of getting gestational diabetes later in the pregnancy, right? So if that number is already elevated, you need to watch yourself. Right.
So all pregnant women out there or couples who are pregnant, make sure your medical professional, your OBGYN, your doula, whoever, your midwife, make sure if they're doing any blood testing in the first trimester, tell them to collect your A1C, your hemoglobin A1C. That could be a marker that is more indicative that there's a problem without requiring you to do a glucose tolerance test at any point in your pregnancy later on. It is a good indicator that you are moving towards a gestational diabetes scenario. So, what would be your recommendation for those who, if their A1C was elevated in the first trimester of their pregnancy, what would you recommend to them dietary wise? Would you recommend what would you recommend to these people
Well,
to help them throughout the rest of their pregnancy?
Be obvious to not have obvious sugar, right? I think most people go, well, I probably shouldn't have a bowl of ice cream every night and start myself with my sugar drink or whatever, that they understand cake, donuts,
Pop Tarts,
like obvious sugar.
candy, cookies, cakes, ice cream.
They also need to think about carbs. So, muffins, rice, corn, wheat, pastas, all of those things are simple carbs and they convert straight to sugar in the bloodstream. And so you really want to be careful about those too, which, is hard. You need some quick energy in pregnancy because it's like you're sitting there, but you're running a marathon. So while we talk about lots of proteins and healthy fats and things like that, there are going to be times where you're like, I need something to eat right now. I'm getting shaky, which is a normal thing, but you just can't, if you're starting yourself out with cereal and skim milk that's sugar on sugar in the morning or like a muffin or a donut or whatever you're doing, and then at lunch you're having pasta because you went out to eat, and then for dinner you're having a big rice dish, and then you have your cookies afterwards. I mean, you've just eaten sugar all day, even if you put protein and healthy fat on it.
Love it. All right, so I have something I want to explain to all of you that I just learned yesterday as of this recording that I was very thrilled about. I was doing just my own research on NAC, N-acetylcysteine, and I was on PubMed.gov, which is where all your medical journals are published here in the United States under the NIH's guidance. And if you go to PubMed.gov, I typed in NAC studies and humans. Enter. I was shocked to see that there were a number of pages, and the pages have anywhere from 6 to 10 different research studies, peer-reviewed and published per page. There was over 1,500 pages of research studies done with NAC in humans. And about page 10, as I was surfing through all those research studies, Michelle, I came across a study where they took gestational diabetes pregnant women and they were reversing within just a day or two all gestational diabetes with N-acetylcysteine supplementation, NAC. So anybody out there who's been told there's no supplement that's been studied or referenced or known to improve the outcomes of this gestational diabetes while pregnant, that is absolutely not true. N-acetylcysteine at 1,500 milligrams a day up to 2,000 milligrams a day during pregnancy can often reverse gestational diabetes all by itself. This is an incredible antioxidant, similar to vitamin C's benefits in the human body to reduce inflammation and remove toxic free radicals that cause damage and disease and gestational diabetes. But I found it shocking that N-acetylcysteine was published to be a known cure and preventative for gestational diabetes. What a very simple recommendation. And remember, you can ask your medical doctor or OBGYN or your midwife if NAC may be right for you, but they need to go look up those research studies. They may not even know. It's very, very exciting. I'll be doing a show very soon and educating all the audiences on that. But how great it is that there's an all natural supplement that can be picked up online without a prescription that can help people with gestational diabetes. I was very excited and thrilled to see that because there's so many people that are actually diagnosed with that. All right. Any other complications or issues you would recommend or warnings you would give to people when they're pregnant, going to be pregnant soon? Anything else you would say in general to them to help them as we wrap up this interview?
I probably want to point out that babies that are gestating and a mom that has gestational diabetes that is not controlled and very out of control, those are some pretty sick babies after they're born. Okay, so I my mainstream provider friends, like the NICU people and stuff, they're like, man, your people are a lot. And I was like, they are, because sometimes I have to say, hey, like, this is a really big deal. And so if you have a baby that you have gestational diabetes, and, a lot of the country people were like, I'm not doing that. Okay, great. But what are you doing?
Yeah, what are you doing? I'm switching to organs.
Know that you could have this really perfect diet and for some reason you flipped over anyways, right? And so it is important. Like, those babies are very sick. I mean, I've gone down to the OR and like a 12-pound baby popped out, and I'm like, I'm just going to go ahead and stick a central line in the umbilical cord right now, because there's no way this kid's going to have a blood sugar. And because what happens is mom's pumping all this sugar across the placenta, right? And so the baby's pumping out insulin, dealing with mom's sugar. Well, what happens when you cut the cord? Bloop, there goes your sugar, and the pancreas is over there going insulin, insulin, insulin. And so those kids crash, and they take a lot of sugar and medication. I mean, they're sick kids. So it is important. You can say no, but be smart. If you're like, you know what, my diet isn't very good, or I am overweight, like maybe I should drink the orange juice
instead of Dr. Pepper.
Or maybe I should hear what Michelle and Dr. Ardis said and have that hemoglobin A1C checked and monitor myself and do the best that I can. But sometimes the crunchy world just likes to say no, 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 and keep going. And so just know it can be serious.
Now, sticking with the gestational diabetes topic just shortly, if you go look up Glucola, Glucola, you can look up online what are its side effects, its complications, and they talk about elevated heart rate. I mean, how many times do they scare pregnant moms? Your baby's heart rate's going up, and this is an emergency. We need to do a C-section right now. Okay, just so you know, Glucola does that to you. It can cause nausea and vomiting. I mean, I don't know about you, but how many pregnant women want to add the possibility of being nauseous for any period of time while they're pregnant to do that test? The hemoglobin A1C test doesn't require drinking any sugar. Glucola doesn't require any additional nausea possibly or elevated heart rate for your kid. Just do the A1C test and evaluate that and make sure it's a part of the what's called a complete blood count CBC normal panel during your pregnancy in the first trimester. That would be the great indicator. So NAC is one thing I would recommend, and then Google lipid resin extract is absolutely proven at 1,500 milligrams to be safe for pregnancy for all human beings, and 1,500 milligrams a day is known to help reverse diabetes scenarios in both the mom and the baby. So those are just two things to recommend people to consider, and talk to your healthcare provider and those overseeing the pregnancy or coaching you through that. Maybe ask them if that would be right for you or something to consider after doing your blood test and getting your hemoglobin A1C. All right. So lastly, I would like to make sure everybody knows where they can find you, young lady. So we've highlighted this before many times over the last several years, but this is your wellness sanctuary. Go to wmwsanctuary.com and you can learn more about Wonderfully Made and Michelle Rowton's team. And we'll show you the team here, actually. I think we've got them. Here's your practitioners: Michelle Rowton, Julie Kincaid, Jana Spillers. Anything you'd like to highlight about your clinic and where people can call? What's your phone number and where are you located?
We are in downtown McKinney. It's 469-631-0023. There are two of us that actually are very much specialized in babies and toddlers. And then we have Julie, who sees older kids, but one of her biggest passions is actually the moms. And so we have a lot of moms coming in that have been having babies, and we always put our kids first and put ourselves last, and they're ready to look at labs or they're ready to look at themselves. And we're having a lot of really good results there. So I'm super happy to be a part of that as well.
Aren't you a founder for this? Isn't this your place?
Yeah.
Yeah, there you go. All right. So wmwsanctuary.com. You can learn more about Michelle Rowton and her team at Wonderfully Made. Do you do also like conference calls around the world if people are interested in
Oh
consulting
yes.
you?
I always get interesting people jumping on my schedule for just phone chats, phone consults after I've been on, and I love it. So I think the breastfeeding one we did, I had several calls all around of people just going, nobody will help me. I didn't know these things. How do I find this? Or how does this work? Or can you explain more to me about this? A lot of education going on. And so I think the two that I remember are Connecticut and Oregon. There were a couple other states in there, so that was fun.
That's awesome.
Yeah.
All right, Michelle. Thank you so much for joining us at the Dr. Ardis Show. Thank you for watching at home. And any particular books or other websites you recommend to women that they should read or consider while pregnant, outside of what to expect when you're expecting, or websites they should peruse, or no, off the top of your head, any?
I mean, I usually actually send people to Weston A. Price and
Good.
they have a spinoff. I'm not going to remember it now. You'll have to edit that out.
No worries. They'll edit it out.
I'm actually writing a book that I can never have time to finish. Just right now, it's just the first year of life. I always wanted to write it from thinking about getting pregnant, like preconception through the age of 2, because that's the most important part
Believe it.
of somebody's development. Like if that goes really well and we're not exposed to a lot of stuff and you make it to the age of 2 and your child hasn't had antibiotics, studies show that their outcomes later in life are just
Astounding.
better than everybody else's. So one day
We look forward to that. And then we'll have you back on the Dr. Ardis Show and we'll talk about it. It'll be exciting. Yeah. All right, everybody. Good luck with your efforts to have a full-term pregnancy successfully with a very healthy child. We are here to support you and love you. I have 5 children that have, been born and are healthy, 4 to adulthood. Michelle, you've got 3 kids you've given birth to and kept them safe and well. And those principles that we have adopted in our own lives and throughout our own pregnancies have actually paid massive dividends, I believe, with the health outcomes of all of my children, just like you said. So not vaccinating them during pregnancy, not vaccinating them after being born, none of them been given any antibiotics in their entire life, actually, and using natural references that I just bought in different libraries and half-priced books and online to learn how to keep a child healthy, keep myself healthy, and basic principles in general to keep my family healthy, which included for myself. I took milk out of our home 27 years ago. I took sugar, candy, cookies, cakes, ice creams, all that kind of stuff, reduced how often we were going to be exposed to that, took cereal completely out of our home. I used to eat bowls of cereal every day, believing that was the most important thing I should start every day with, breakfast coming out of a box. But anyway, those kind of principles we just adopted. And then there's never been any sodas in our home, no alcohol in our home. So these are just some of the principles that we think have provided massive benefits. And then we've not gotten any prescriptions for any of our kids. And they have been very, very healthy and no medical conditions, knock on wood. And we expect that to continue as they adopt these principles into their own life as they continue to go off and live on their own. Anyway, this is what we want for you and your families as well, is a very healthy pregnancy, healthy child, and try to reduce the burden of stress that we see so chronically for so many young parents of young children that they experience now. Any last final thoughts, Michelle?
That's great. Same. I mean, I actually have a kid now that had antibiotics. The youngest, she actually was admitted to the hospital, and I really thought she was septic, like blood sepsis. Thank God that was negative. It should have a really bad UTI, and which is serious in young infants. Like I always tell people, that's the one thing you have to be, the big thing to be on the lookout. And so I always say God tortures me for a reason, because like I deal, how many kids have I sent them like, you need to go to the ER. This is a young baby with a high fever and they need to check for UTI and do all of the things. And so I get it because I worked in the hospital, but I got to experience it from the other side and it sucked. And so for our kind of people, you're like, oh my gosh, this is awful. I mean, I have a 26-year-old that's never had antibiotics, for heaven's sakes. The 9-year-old hasn't, the almost 7-year-old hasn't. she's fantastic.
Awesome.
So I just tell people I've been recovering those kids that I've seen in my office for appointments for a long time with really good results. And so I knew what to do and I did it, and she's solid.
I trust Michelle Rowton, so I'm going to trust her when she gives this answer just because you just said it. So we're going to wrap up the interview with this. What is the degree temperature in an infant or a child that you say is alarming enough that they should, you even felt to make the call to the ER or encourage those patients to call the ER on their child's behalf? What's the temperature where you go, whoa, that's alarming?
If they're under 3 months and they have a fever that's hitting over 101.7, like you're hitting 102, you need to go in. And there's not an obvious reason. Like sometimes like everybody has a cold and they're all snotty and now the baby's snotty and has a little fever. I'm like, okay, well, we know what that is. It's when you're like, when you have a baby like I did, I'm a baby person. I'm like, wow, she actually fussed at me for like 10 minutes today. I mean, she was so easygoing. And then I was like trying to breastfeed her to sleep. And I texted my husband, he was next door at his mom's house. And I said, can you come hold the baby? Like, I really need to take a shower. And I think she's getting sick. I wasn't worried about it. Well, I get out of the shower and I looked at her and I was working with her and she decompensated like right there in front of my eyes. And I was like, get your mom over here. We have to go to the ER. And he's like, running, what? So I tell people like, if they're under 3 months and they have a fever and there's no known reason, you have to go in.
Got it.
The other kids, could you please not go into the hospital for a $3,000 dose of Tylenol in a popsicle? Okay.
Amen.
Like, don't do that.
Good. So what's the temperature for the other kids where it's obvious everybody's got colds, flus in the family or symptoms and a young child? What's the degree?
Did you check your kids' temperatures? Like, I don't actually have a thermometer in the house.
Yes, I did actually. I had a rectal thermometer. I didn't use it very often, but it was pretty accurate.
It's all the time, and they're sending me a message, and rectally it's this. I'm like, let's not stick things up. We don't need to stick things up the butt. Kid already doesn't feel good. Like armpit works, or just why don't you do skin to skin and breastfeed the baby, and we'll be fine. So I just tell people, oh my gosh, it's 104 because they think brain damage. But when brain damage happens? Like
yes, I do. Yes, I do know. Yep, 108. 108.
Now, if you're probably hitting 105.6, every once in a while you get a kid that gets wild and does that, and like the thermometer is not broken, might want to handle that. Yep. Please don't stick them in a cool bathtub. That's when most febrile seizures happen. And also, if you have a high fever, are you going to get in a cold bath?
I don't like cold water.
No. So always think, would I get in a cold bath if I had a fever? No, I would not do that. Don't put the baby in there. Don't put the 5-year-old in there.
So this cold plunge phenomenon, we're watching this fad right now. You don't recommend the hot baby being thrown in one of those?
No.
All right, just checking. All right.
No, my husband
you've heard it here first. Yes. You heard it here first at the Dr. Ardis Show.
Don't do that. Most of the time when I have a patient that's had a febrile seizure, it involves water.
Oh,
no
amen.
showers, no, like you can take the washcloth, the cool washcloth.
Yeah.
Keep them hydrated.
Amen.
If they're older, give them ice chips, give them some calcium lactate, and mostly calm down.
You heard it here. I'm Dr. Ardis. This is Michelle Rowton. Good luck with your pregnancies. I cannot wait to watch you grow your family, experience the joy Michelle and I share of being parents with very healthy children. That's what we want for you too. God bless you all. We'll see you next time on the Dr. Ardis Show.
Disclaimer, please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.